This is a medication that can be used for several things. It's actually used as an antiepileptic to treat seizures, and it can be used for peripheral neuropathy, neuropathic pain, and prevention of migraines. It can also be used for restless leg syndrome. The reason you'll probably see it used most often is going to be for seizure treatment and neuropathic pain. So what is neuropathic pain? What'll happen a lot of times is patients will come in and it's like this tingling sensation that they'll get in their feet, this tingling pain. So this is one of the reasons we really like to assess the type of pain. That's what we really ask our patients is, what does it feel like? We don't necessarily just ask, are you having pain? What's really important to assess is, what is the pain feeling like? If the patient describes like a tingling sensation type of pain, like their leg is falling asleep kind of pain, this is really our neuropathic pain, and Neurontin or Gabapentin can be used to help to treat this kind of pain. So a lot of times in spinal patients, they'll come back from surgery and we'll throw Dilaudid at them, we'll throw Norco at them, we'll throw all these medications at them to try to treat the pain, and it does nothing for the pain. They're still unable to sleep. For this reason, a lot of times these patients are also prescribed Neurontin. Neurontin can actually help with that pain and help them to sleep, where, we think they just had this massive surgery, had their back opened up. But as we get in there and manipulate all these nerves, during a back surgery or neck surgery, we can actually cause a lot of this neuropathic pain. And so this Neurontin, this Gabapentin, can help to resolve some of that pain. So the biggest suggestion there is to really assess the quality, the type of pain that your patient's having. The exact method of Gabapentin and the way that it actually works, the mechanism of action, is not really fully known. But Therapeutic Class is analgesic adjunct, anticonvulsant, and mood stabilizer. Some of the nursing considerations to keep in mind are, we really want to monitor our patient closely for any changes in behavior or depression. If we're giving the medication for seizure activity, we really want to watch for seizure activity and make sure that we have our seizure precautions. The bed is low, there are no restraints, there's no restrictive clothing, and we want to assess the patient's pain level. If we're giving this for pain, we don't want to just slam it at them and see, and disappear for the rest of the night. We want to make sure that the medication is actually working and treating the pain. If we've tried, our normal pain medications, our normal analgesics like Dilaudid or morphine or Norco or whatever, and that's not working, and then we try a Gabapentin, it would be really important to kind of check to see if that's actually working. One thing that I would do with a lot of my patients is, your Dilaudid would be Q4 hours or whatever, your Gabapentin would be Q4 hours. So what I would do a lot of times is I would stagger those, where I would give my Dilaudid 2 hours later. If the patient was having pain, I would give Gabapentin. Then 2 hours later, if they're having pain, I would give Dilaudid or Norco or whatever. And so that way you're staggering the pain medications as well as kind of treating different kinds of pain. And by doing that, you would see these patients that were just screaming and having pain and never able to sleep or anything, were actually able to get some rest and to sleep. Just by kind of staggering that, staying ahead of the pain, and treating different pain pathways. Patients should really take this medication as prescribed. Okay, it's important that they don't overdose themselves and cause any other problems. We really want to monitor for suicidal thoughts, confusion, depression, drowsiness, ataxia, facial edema, and hypertension. So this is a really helpful medication. It's something you're going to see a lot, that I saw a lot, simply because working neuro ICU, you have patients that are getting this for different reasons, but a lot of patients are receiving it. But it's a good one to be aware of, and it's a good one to think about if you meet patients or come across patients who are complaining of like the leg falling asleep type of pain and that it's just never going away. This could be a good option for them. This has been another episode of the Nursing.com MedMaster podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.